Welcome back to part 2 of our pre-recorded pharmacology webinar. So if you're here, you've already seen part 1, signed up for a free account on Picmonic.com, and learned the 10 Picmonics from the shared playlist. Now, here's Dr. Wyatt to continue on to part 2 in the series of Pharmacology Know Your Endings.
I'm Kendall Wyatt, the content director here at Picmonic, and that's all we gotta go. Let's get started. So, part 2, antibiotics. We're going to talk about different antibiotics. Inside of here, we're going to, again, show you everything you're seeing is all the pictures from our Picmonic learning system, which you can go and sign up for free and check out all out, or of course buy, which would be a better idea to subscribe. But here's our antibiotic guy with our bacteria static, or bacteria being shocked, to help you remember it, because we use images to help you remember everything you need to know. Now, we have literally over 150 medications alone. I think we're up to 190 medications in literally every product where we have medications. So if you have trouble memorizing things like antibiotics, you need to go check out Picmonic. You won't regret it. It's definitely where we're at. So let's jump right into some antibiotics. Now, the first one I want to talk about are tetracyclines. I love tetracyclines. Now, every time I always talk to somebody like this, I'm like, oh, let's talk about tetracyclines. One of the tetracyclines is tetracycline. And they're like, what are you talking about? Yeah, okay, I know. I didn't make this up, okay? They're tetracyclines. One of the tetracyclines is tetracycline. Who thought of that, right? The other one's doxycycline. But what's important is you can remember tetracyclines by remembering the ending cycline, by this cycle. We got these beautiful little cycles here. You can just remember that. And, of course, to help you remember tetracyclines, we have a tetris cycle. So, I mean, that seems to make sense. But more importantly, I love the next one. I just love this one right here. Oh, this is my favorite character. One of my favorite Picmonic characters, which is a doxycycline. Doxycycline, that's right. So here we've got our cycle again, but we got a doxycycline. Oh my God, a dog riding a tetracycline. Okay, well, whatever. We have some people think of this here. They work here. They're crazy. But it helps you remember, and that's what the point is. So tetracyclines, really common antibiotic for questions that I see. I see lots of questions on tetracyclines. When I say tetracyclines, what's the one thing you need to be worried about? You should be thinking about, or you should think about considerations, things you need to know about that drug. I mean, you should have a couple of them, like right there on the tip of your tongue. You should just be spitting it out, and, just like right there. What is it? Take a drink from my magic cup. I get a few cents every time I take a drink from that if you missed it earlier. So you're just going to have to deal with that. I'm sorry. If it makes you angry, you can just turn it off. Just click close. I don't mind. I'll still be here. Tetracyclines. What are the things you need to know? Well, you need to be thinking about a couple of things really important. You should be thinking about bones. You should be thinking calcium. You should be thinking about cations. Kendall, cations. What is that? Why do I need to think about that? It's chemistry crap. I don't care about it. I don't want to see again. Well, with tetracyclines, if you can just remember bones, calcium, cations, then you can remember everything you need to know with tetracyclines. Now, this is our Tetracycline Picmonic here. Here's our 2 Picmonics we have for this. There's a couple really important things. The number one is that you don't want to take tetracyclines. You would not want your patient to take tetracyclines along with milk, iron, or antacids, which contain things like magnesium or calcium, right? Right? Why? Well, those medications, tetracycline binds to those ions, those cations. It binds to them and keeps them from being absorbed. Essentially makes them useless. There's no point in taking it. Really, really important. So for the same reason, because it binds to the calcium, we don't give tetracyclines to children under age 8 years old or pregnant women, because it keeps fetal bones from developing. It prevents that hyaline cartilage from really forming nice bones when those little babies are developing. And as you're growing in those core years of growing, I didn't get a grow when I was a kid. I don't know what happened. I just living the life of the short people over here. I know the camera makes me feel tall, but just not. But it's a separate topic. Anyway, tetracyclines. Don't give tetracyclines to kids. No, not going to happen. That's a question. Don't do it. The answer is no. Now we got over that. The last one, and super important, when you think of antibiotics in general, you should be worrying about photosensitivity, but tetracyclines especially. Tetracyclines are no for photosensitivity, so make sure they're sun protection, sunscreen. We got all that here up here. You've seen him in the top left, this little Picmonic. We got a little bacteria with putting some sunscreen on his face. How can you unsee that? I know it's weird. It's okay. It helps. We know that the weird things really help you memorize, and that's why our product is research proven to help you. And that's crazy images work. Trust me, I know it's weird, but it's fun, right? Aren't you having fun? So don't give tetracyclines for those reasons. Now, when we think about tetracyclines, you always want to never give expired medications. I mean, we always worry about that. And tetracyclines are one of the ones that are the really worst ones for expired medications. Just a side note, not in the Picmonic, but it's really important. So for that same reason, we see tetracyclines cause this yellowing of a teeth. Again, I forgot to mention that, but that's just another kind of important point to cause yellow teeth and brittle bones. So the next type of medication, I just feel like I skip over this one every time. So easy. But penicillins. Penicillins and insulin. There's different types of penicillins. There's penicillins, there's aminopenicillins, there's antipseudomonal penicillins. With penicillins, remember they end in -cillin, but I get the hiccups already again. Every time I do this, I take a drink, I talk a lot, and then I get the hiccups. I'm sorry. Cillins, you want to worry about allergy. You probably are already screaming at the screen. Just say allergy already. Just say it. I know you're going to say it. And that's right. I did. There, I said it. You want to worry about allergy. And it's really common. And it's just something that you need to be aware of. Penicillins, old drug, good drug. Sometimes seeing a lot of resistance. But remember, common with a drug allergy. So we've got, forgot to open up. There's our Armor Ox for Amoxicillin and our Pencil Villain, which is Penicillin, one of our fun characters there. So here's our Picmonics for those. Here we've got inside our little allergy alligator to help you remember. And remember, you don't need to, depending on what level you're at, but penicillin really only works for gram-positive bacteria. So we got our little graham cracker positive angel guy, and that's just what you need to know. So remember when you talk about allergies and things, to always identify, tell your patient to make sure they wear a wristband for making sure they have a emergency alert band or allergy ID band or whatever. I have mine on my iPhone. I just hope I don't get a 70-year-old paramedic doesn't know how to open it. Anyway, it's okay. Now, the next type of medication are aminoglycosides. I see so many people freak out when I say aminoglycosides, name them. Give me the aminoglycosides. And they're like, I don't know what to do. Aminoglycosides are really easy, and this is probably one that you can learn a lot of drugs really fast. So when I talk about aminoglycosides, the first thing you should be thinking about are mice. Yeah, for mycin. Aminoglycosides end in mycin, spelled with a Y, spelled with an I, kind of the same. But even more, when I say aminoglycosides, and I show you our Amigo glider here, I know Amigo glider with his mice for mycin, you're going to remember aminoglycosides. Now, when I say aminoglycosides, can you name them all? I don't know. Let's see in a sec. Because you can really just remember it with a mnemonic. Now, I have these on this slide here for you, so you can remember that these are not included. These are the weirdos. They're kind of the weirdo ones, which we're going to talk about next. Glendamycin, vancomycin, azithromycin. Now, I'm going to step on a soapbox here and say it is not, there's no O in this at the end. It's not myocin, it's azithromycin. Okay, there you go. That's all I'm going to say. But I'll correct you if you say it wrong. Yeah, I'm talking about you. Clindamycin. There you go. We said it. We said it together. Say it out loud with me. Thank you. Let's move on. So when I talk about aminoglycosides, what are the aminoglycosides? Well, I'm just going to show you here is our Picmonic on it. I'm going to help you remember this Mice-Ins Club. Well, when you think about the Mice-Ins, this little strip club that come in with our mouse here, I want you to remember gnats. G-N-A-T-S. Because you can remember, right there they are. I got them in the perfect order for you. G-N-A-T-S. See those gnats flying around the screen? Gnats, or gnats, if you want to just say it like that, but I'm going to make fun of you again. So here we got our gnats, right? Gnats. The G is silent. That's right. Gentamicin, neomycin, amikacin, tropomycin, streptomycin. Yes. Got them. Yes, amikacin's weird, but that's why we have the image. So when we look at the aminoglycosides, here you can see our gentleman mouse for gentamicin. Here you can see our neon mouse for neomycin, our moccasin-wearing mouse for amikacin, our cobra mouse, for tobramycin, and this stripper mouse for streptomycin. So you can remember them all right here inside of this Mice-Ins Club with the gnats. Really easy to remember. Now, when you think about aminoglycosides, they're really kind of toxic medications. I mean, they're pretty potent things. And what do we worry about? When I'm giving any type of medication that can cause toxicity, what am I going to watch? I'm going to monitor the levels. I'm going to do peak and trough. So here we've got our peak and trough here. Peak and trough. Now, with aminoglycosides in general, there are two big things. You need to be spitting out those side effects. And if you've caught on to how we're doing this now, you probably are already saying it out loud because you can see it in the image. Good for you. Your eyes are awake. I'm glad. But we worry about with aminoglycosides. We measure peak and trough because of renal toxicity. We've got our toxic green glow kidney and our toxic green glow ear for ototoxicity. Now remember, from our diuretics, I'm talking about loop diuretics, toxic green glow ear, ototoxicity, we're going to worry about tinnitus, ringing of the ears. You're going to worry about that's going to be the clue that this is going to be a patient that may be toxic. The next type of medications are macrolides. Now I see a lot of students really just mess up when I say aminoglycosides and macrolides rather than giving them an actual type of drug. You don't want to mix these up. Really important to make sure you know the difference. So macrolides, I'm going to help you remember them because you can remember the macaroni lights here in this image, and you can remember these throwing mice because where else do you want to throw mice except for, every time. Who wants to, I know there's some weirdos out there that have pet rats. I have seen that actually. It weirds me out. I'm going to be honest. I got a dog. You've probably seen Stitch. As far as I'm going. I had an iguana once when I was a kid, but I'm kidding. I had a pet skunk when I was a kid and ferrets, but I never had a mouse or a rat. Actually, that's a lie. We had some mice in our house. They wasn't pets, though. They wasn't very nice. Anyway, so throwing mice. Thromycin. So, again, thromycin, not thromycin, thromycin. So, azithromycin, clarithromycin, erythromycin, there are three. There are three, and you can remember them again with this ACE, A-C-E. See, I put them in order for you. Isn't that so nice? And if you're a little bit more advanced, maybe you're doing, higher practitioner level, you can remember the P450, the fact that they cause P450 interactions in this exact order, too. Azithromycin, not a lot of interaction. Clarithromycin, medium. Erythromycin, a lot of interaction with P450. Side note. Not so important at the nursing level. So what's important to know with macrolides? When I say let's give a macrolide, what are you going to be taking azithromycin for? Well, you probably remember it because it's often called a Z-Pak. We're giving a Z-Pak azithromycin. If I give you azithromycin, it's usually for an upper respiratory infection or a URI. We've got our lungs filled with bacteria here in this image. So you can remember, what's the big thing you need to worry about, though? Side effect-wise, when I say, macrolides, what is it? Well, azithromycin, not so much, but erythromycin, which is, again, more toxic or has more side effects, we worry about QT prolongation. There we go. Said it. Thank you. QT prolongation. So we've got our QT heart here stretched out with this big long tail because it can prolong that QT interval. So if it's prolonged, if it's over the 0.4 seconds, we know that that's a prolonged QT interval and it can cause RNT phenomenon, sudden death, arrhythmias, lots of things there we want to worry about. Not so good. The other thing when we give macrolides, now all antibiotics can cause GI distress. We've got our little GI distress guy here in the bottom left. But macrolides often cause, or you're at risk for C. difficile. C. diff, very lovely smelling diarrhea if you've ever encountered it. It's just like, I'm going to get me a C. diff scented perfume, right? I know that's you. You're going to think back to this if you haven't smelled it, and then you're going to be like, yeah, okay. That was funny. You're not laughing now, but you will later. Just kidding, it's disgusting. Okay, so the next medication type I want to talk about are cephalosporins. Now, cephalosporins are lots of different types of medications. There are 5 generations of cephalosporins. Now, cephalosporins, you can remember by not a drug ending, but a drug prefix. And that's Ceph, C-E-F. Cephalosporins, Ceph. So, of course, we have our chef spore head here inside of Picmonic. So our chef spore head, isn't he so cute right there? Just little chef spore head, so cute. But you can remember him because of the chefs. So inside of Picmonic, we have lots of different chefs. We have our cephalexin, our chef flexing. We have our ceftriaxone, our chef with 3 axes. And we have a cefotaxime, our chef taxes. So many different types of chefs inside of Picmonic. Again, 5 different generations of cephalosporins. And really, they start out by, really working with gram-positive organisms and working all the way up to really some really big gun cephalosporins, ceftaroline as a 5th generation cephalosporin. New, the higher generation usually newer and cover a lot more organisms. Now, what do you need to know about cephalosporins? Well, there's a few things. Cephalosporins are, I thought I had my image in here. I guess I don't. Cephalosporins are really commonly given to a patient with a penicillin allergy. But what do we worry about when we give a patient with cephalosporin penicillin? Let me start over. What do we worry about when we give a patient a cephalosporin? We're going to ask them if they have any drug allergies, but are you allergic to penicillin? And they're going to say, yeah, I am. I got a little weird rash, and it went away. Or they're going to say, I had a full-on anaphylactic reaction. I had trouble breathing. I had to be hospitalized. They had to give me epinephrine. So with cephalosporins, there's a 10% chance of a cross-reactivity, or small chance that you could be allergic to cephalosporins as well, because they're also a beta-lactam drug. That's how the medication is made. Now with that, what that means is typically if a patient had an anaphylactic reaction, a cephalosporin is a no-go. If they just had a rash, you're going to warn them about the reaction, and then you're going to give it anyway. But you're always going to ask, have you ever had a reaction to any types of medications when you're given these things? It's really important to ask. But you want to ask them what type of reaction. So with cephalosporins, that's about it as far as big things, mainstream things. And of course, there's several different little things for all the types. Now the next type of medication are fluoroquinolones. Spell that 5 times fast, right? I can never get it right. I don't know. Thank God for spell check. Anyway, fluoroquinolones. Now, fluoroquinolones you can remember by our Flower Queen character here. Isn't she just so pretty? Flower Queen, she's just so special. Smiling face and everything. But Flower Queen here for fluoroquinolones have what type of drug ending? And that's floxacin. So we've got our flockavoxin. Flockavoxin, Flower Queen, fluoroquinolones. Ciprofloxacin, levofloxacin, moxifloxacin, oxifloxacin. There's several different floxacins in there. So I just got 3 here. But you're going to see cipro or ciprofloxacin given very often. So fluoroquinolones are a little bit differently on kind of where they target per se. Some of them are a little bit different, but a lot of them work great in urine. And levofloxacin is a lot of a respiratory. So here's our actual Picmonic. You can actually see how the Picmonic looks. We have fact lists on the left-hand side over here and how the actual image works. But what's important to know for fluoroquinolones? Well, I mean, I have it here on the screen. You can just look on the left-hand side. Actually, I don't have all of it here, but it's kind of, I can't scroll because I just took a screenshot. Anyway, with fluoroquinolones, what's important? Well, you can remember everything here. Flockavoxin, we got our flockavoxin in here. But what do you need to know? Well, if you're, there's a couple big ones. With fluoroquinolones, we worry about Achilles tendon rupture. Is it super documented that this has happened tons of times, and does it happen very often? No. But if you have a patient who would have any kind of Achilles tendon pain and they're on a fluoroquinolone, stop the medication immediately. Notify the physician or stop the medication, switch to something else. The other one is not taking milk and antacids. Because if you take milk and antacids with a fluoroquinolone, these medications, especially tetracyclines and fluoroquinolones, very often they cause an upset stomach. You know, they cause GI distress, or GI distress guy. But very often people believe that they can just take my medication with a glass of milk because a glass of milk neutralizes all that GI acid, right? And it won't upset my stomach. But that's absolutely a no-no, again, with fluoroquinolones. Milk and antacids actually inactivate the drug, causing it to not be able to be absorbed. Again, rendering it ineffective. So the other thing with fluoroquinolones that's the same as tetracyclines is photosensitivity. And we've got our little camera with the crying sensitive tears to help you remember that. As well, we don't want to give fluoroquinolones to children, but most importantly, don't forget about this one, really kind of an important one I'm seeing a little bit more often, not to give fluoroquinolones to patients with myasthenia gravis, because it can cause an exacerbation of symptoms. So fluoroquinolones, remember, floxacin, flockavoxin, and don't give them milk or antacids along with it, and Achilles tendon rupture. So before we go to that, we're actually going to move on to part 3, so stick with us. It's going to be in the next video in the playlist. So if you landed on this one by accident or just happened to go here, there's one before this, which is antihypertensives, and then we're going to move on to part 3, which are psych and some other medications. Again, learning more pharm drug endings. So if you just tuned in, you don't know us, we're not best friends, you can subscribe, you can click that subscribe button there or there or there, wherever it is. Click that, it's really important. Makes me feel good. I don't cry myself to sleep at night. But you can sign up for a free Picmonic account and see all of these images with everything else, all in an interactive system at Picmonic.com. It's really important that you do it. So share this with your friends, or, you know, and if you're angry, you just have mean things to say, just don't. Just keep them to yourself. Thanks. We'll see you over in the next video, part 3, psych, and kind of a hodgepodge of other medications. I'm Kendall Wyatt. We'll see you over there.
That completes part 2 of our pharmacology webinar series. In this part, we learned about tetracyclines, tetracycline side effects, Penicillin, Ampicillin and Amoxicillin, Aminoglycosides, Aminoglycoside side effects, Macrolides, Cephalosporins, and Fluoroquinolones. To watch the finale of this 3-part series, just click the link below. Picmonic subscription is required. As a Picmonic Premium member, you'll be able to watch over 1,000 Picmonics, really master the content, and then quiz yourself on what we covered in the series. In Part 3, we'll be learning about psychiatric medications and other miscellaneous meds, including the little details you need to know. See you over at Part 3.